Hi, everybody. I'm Connie Rao. I'm president of the Friendship Heights Neighbors Network, and we are partnering with Little Falls Village today, another important villages project, in bringing you this presentation. I think everybody on this call knows how important villages are in bringing people together for social networking, but also to learn new things. And one of the things that I think we all, as we age, need to know more about is what's happening to our eyes. So many of us are already dealing with one or two or more conditions that we had never thought would occur. However, we're going to learn more about that today. I would also like to thank very much the Prevention of Blindness Society of Metropolitan Washington, with whom we are partnering for this event. I also remember that we have another presentation on April 25th on low vision resources, services and support, also in conjunction with the Prevention of Blindness Society. So thank you so much for coming. And I want to now turn this over to Sean Curry, Programs Director for the Prevention of Blindness Society of Metropolitan Washington, and welcome everyone.
All right. Good afternoon, everyone. And thank you, Connie, for the warm introduction. My name is Sean Curry. I'm the Programs Director at the Prevention of Blindness Society of Metropolitan Washington. We're a nonprofit serving the DC Metro community. We have various different eye-related programs, and we serve from very young children to people over 100 years of age, as well as the entire vision spectrum. This includes our low vision programs, where we have a low vision resource and support group network, as well as a low vision resource center where you can come visit us, make an appointment, and also learn about the different resources and services and try out all the technologies that are available. We have many, many other programs. That's not what we're talking about today, but if you're interested in learning more about our organization, you can visit us at youreyes.org. But for today, I am honored to introduce our special guest, Dr. Narmien Murdock. She is a third-year ophthalmology resident at Georgetown University in the Washington National Eye Center. Dr. Murdock has extensive experience both in the eye care world and also volunteering. She's done all kinds of volunteer work, ranging from things with Boston University all the way to the Shriners Hospital for Children. So, Narm, we know that you have a really great passion when it comes to serving others and for the world of medical care. She also completed her medical degree at Boston University. So welcome to the DC metro area. We hope you like it. I know it's a little bit warmer, but we hope you like it down here. But without further ado, I'm going to pass the mic over to you.
Thank you. Thanks, Sean. Thanks for everyone for having me today. I'm really passionate about eyes. So I'm excited to talk to you guys about your eyes and what to expect, what kinds of changes to expect as you get older. I'm going to share my screen because I have a presentation for you guys. And I want you to be able to ask me questions as we go, especially if you need me to talk slower or repeat something. You guys just let me know.
And while you're pulling that up, folks, if you have any questions, to unmute, you can either put it in the chat box, or if you want to unmute yourself, the icons at the bottom left of your screen.
Perfect. Okay. So we're going to go ahead and get started. I'm going to touch a little bit on low vision as well, and what it means to have low vision, because sometimes that can be a little confusing. And then we'll go ahead and talk about the changes that we expect to see in our eyes as we get older, and then what kinds of diseases we wouldn't necessarily expect with age, but things to look out for. So the first thing I wanted to do was define low vision. So low vision does not necessarily mean blindness. They're two different things. You can have low vision and not be completely blind. We usually define it as vision that is poor enough that it interferes with your daily activities and impacts the things that you typically would need to do to get around your day. So reading, driving, watching TV, and distinguishing faces and recognizing people. So these are the things that we're going to talk about during this next hour. The first is, like I said, what kind of changes happen in our eyes as we get older that are, related to our age, and then what kinds of diseases are we at higher risk for as we get older, and then what kinds of interventions can we do for those diseases and ways to preserve our vision. So I like to start with a diagram of the eyeball, because a lot of people actually don't know that it's more complex than it looks. So this is an eyeball that's been kind of cut down the middle. This is the front of the eye over here on the left side of the screen. And then the back of the eye is over to the right side of the screen. And we're going to go through, and I'm going to talk about a couple of the structures of the eye that can be affected with age. Okay, so we'll see this diagram as we're going. Starting from the very front part of the eye. The very front clear part of the eye that I have a box around here is called the cornea. You might have heard of that before. And the cornea is a very important structure. It really helps us to see things clearly and refracts the light that hits the back of our eye. So one of the first things that can be affected by age is our tear film, so the tears that we produce. The tear film actually has 3 different layers. It's not just water, but it has an oil layer and it has a mucus layer as well. So all 3 of those components make up a tear. And as we get older, 2 things start to happen with our tears. The first is that the amount of tears that we make goes down. And the second is that our tears are not as high of quality as they are when we're younger. And what I mean by that is the oil layer sometimes in that tear is not as robust as it used to be. And so the tears might evaporate off of our eye quicker. So even though we're making the tear, it's not staying on our eye as long as we would like it to. The result of that can be a disease that we're all quite familiar with, and that's dry eye syndrome. So I'm sure a bunch of us here have dry eye, and it's something that can be very frustrating to deal with. It can cause things like stinging or burning of your eyes, sandy sensation like something's in your eye, or like a lash is in your eye, but there's nothing there. You can have blurry vision, you can have redness of your eyes, and then excessive tearing, because the glands that make your tears realize your eyes are dry, and so they're going into overdrive and they're producing more and more tears. So actually, when your eyes are dry, you might have too much tearing. There are other things that might increase the risk for us to have dry eye. So it's not just age. There are some medical problems like thyroid eye disease and diabetes that can increase your risk for dry eye, some medications, and then environmental things, so smoking, if it's very dry weather, and those types of things can increase the risk for dry eye. Certain types of surgeries, I don't know if you guys have heard of LASIK, but that's one of the surgeries that can increase the risk for dry eye. Cataract surgery is another common one that increases the risk. And then we're going to talk a little bit about the eyelids in a later slide, but the eyelids are also very, very important for protecting our corneas against getting dryness. So we'll talk about those in a little bit. There are ways to prevent our eyes from drying out. The first is pretty simple. So we just need to blink a little bit more. What happens is when we're watching TV or reading a book, or we're very engaged in something, we tend to blink less. And so our eyes dry out more during those activities. So it's good to remind yourself to blink, take a few extra seconds to blink a couple times, look away from the screen, and that can help prevent your eye from drying out. Sunglasses protects against wind and dryness. and dry air. We can review medications with our doctors, see if there's anything on that list that could be drying our eyes out. And then treating things like thyroid eye disease, diabetes that I mentioned before can also help. How do we treat dry eye? So the drops are probably the most common. Some of you might have tried them before. They're called artificial tears. We usually recommend the ones that are preservative free, and the preservatives tend to cause some inflammation if you use it too often, and that's usually why we recommend that you get the ones that say PF or preservative free on them. And then sometimes, I don't know if any of you guys have seen this or heard of this, but we'll put a punctal plug in. What that is, it's pretty simple. So I have a picture here. So on our eyelids, we have a little hole, and the hole leads to the drainage system of the tears. So our eye has some tears, and then they drain into these holes in our eyelid, and then they go down into our nose. That's why when you cry, you have a runny nose, because you're making a lot of tears, and then they're going down into the drainage system and into your nose. So sometimes what we'll do is we'll put a very small plug right into that hole on the eyelid, and that will slow down how quickly the tears are getting drained into the nose, and it'll help keep the eye a little more lubricated. And then, like I said, we're going to talk about our eyelids because they're very, very important in keeping the surface of the eye happy. Okay, so our eyelids, think of them like windshield wipers. Okay, they keep the eye. When we close them and when we open, we keep that eye, the surface of the eye, well lubricated, and it prevents dust and dry air and all of that from getting onto the surface of the eye. So they're actually very important. So if your eyelids don't close well, like this first picture here, this is called an ectropion, but all it is that the eyelid is very droopy. It's kind of turned out. So when this man closes his eye, he can't close it very well. And that it leaves part of the eye exposed, and it dries the eye out, okay? The opposite can happen too, where the eyelid is actually turned inward. You can see here how this person's eyelid is also turned too far inward. And look at how the lashes here are touching the surface of the eye. So that's also not good. It's going to irritate the eye. It can scratch the cornea. So this is also an opposite extreme that's not good and will cause your eye to be very irritated and get scratched. And then one last example I want to mention is called blepharitis. You guys might have heard this before. Blepharitis is a fancy term. It just means that your eyelids are inflamed. So they're red, they might be a little swollen, they might feel itchy and irritated. You might have some crustiness on the lashes. And this is because there's a bacteria that lives on everyone's skin. And sometimes that bacteria eats the little dust that's on our lashes, and it causes some inflammation like this, like some redness and some irritation, and that will also affect the surface of the eye. So it's really important to clean your eyelids very well at the end of the day to get rid of all of that dust and debris from the environment. I'm just writing here, battling blepharitis. So things that will help blepharitis or prevent it are warm compresses, gently massaging your eyelids, using gentle lid scrubs to make sure those eyelids are clean. Some people like to use baby shampoo, for example. And then if it's very severe, blepharitis will sometimes give an antibiotic ointment or an antibiotic pill. Okay, so that was the cornea, some dry eye stuff, some eyelid stuff. Now we're moving a little bit further into the eye, and I have a box around the lens here. So this is where the lens sits. it's like a crystal lens, and everyone is born with this lens. It's also very important because it refracts the light that comes from the outside and helps it focus on the back of the eye, on the retina. Okay, so this is where our natural lens sits. And this lens is actually, when we're young, it's actually very flexible and elastic, which means that it can bend and change shape a little bit. As we get older, the lens changes in two ways. The first is that it becomes less flexible and elastic. So it can't really change shape the way that it used to. And then the second thing that can happen is it starts to get cloudy. So here the lens is pretty clear. If you look at the picture up on the right side of the screen, it's actually a very clear lens. But as we get older, it starts to get cloudy. And that is what a cataract is, okay? I'm gonna repeat it. A cataract is when your own natural crystal lens in your eye gets cloudy over time. And then the light can't enter the eye as well as it used to. Okay, so here it is, cataract. Look here, if you look at the first picture, we see the pupil, this black area, that's where the lens typically is. And it looks dark and clear. But then when you look at the bottom picture, someone who has a cataract, you can see that it looks a little bit more gray and not really as clear, not as easy to see into the eye. So you'll get, if you have cataracts, you might notice a couple of things, okay? Not all cataracts give you the same symptoms, and they won't give you the same kind of challenges with your vision. So some people just notice blurry vision. Some people notice a lot of glare, like you're driving at night or you're walking at night and the street lights are just blinding you, or the headlights. That's glare. You might see that with cataracts. Difficulty seeing at night can also be a symptom of cataracts. Some people see things called halos. So around a light, you'll start to see a little halo of light. And also changes in your glasses prescription. So cataracts can really change your glasses prescription as they start to get denser and cloudier and thicker. So I put prevention in parentheses or in quotation marks because everyone, if we're lucky to live long enough, everyone will get cataracts. It's just something that's completely normal, happens to people at different stages of life. You might be 50 and you might have bad cataracts, or you might be 80 and your cataracts might be not that bad. But we can't 100% prevent the changes that happen in this crystal lens. So some ways where you can slow down the formation of your cataracts. The first is controlling your blood sugar if you have diabetes. So this is a big one. If your blood sugar is out of control and high and low, and you're not able to get it in a good range, you might develop cataracts quicker. The second thing is smoking. Smoking can increase the rate at which you develop your cataract. Protecting your eyes from the sun, and then also from trauma. So we see cataracts form very quickly sometimes in people that have had trauma to their eye. And then sun protection also. There are a few ways to address cataracts. So if you have mild cataracts, you might hear your ophthalmologist say, you have a mild cataract, but your vision is good. We'll give you new glasses. Your prescription changed a little bit, but we don't need to do anything else about it. And that might be the case for a lot of you here, that you have some early cataracts, but your vision is still fine and it's not bothering you too much. So then we give you new glasses and we just keep seeing you every year or so. If you're having difficulty in dark lighting or at night, you might just need to get some brighter lights, and then you'll be able to see a little bit better. But ultimately, the real way to address cataracts is with surgery. So eventually, again, if you live long enough, your cataracts will get cloudy or dense enough that you'll need surgery to remove them. So cataract surgery is the most common surgery done in the United States. It's very, very common. And it's really progressed over the last few decades. Now it's much more sophisticated, it's much more safe, and it's also relatively quick if you have an experienced surgeon that's doing it. I have a 45-second video on cataract surgery. It's in animation, and I wanted to just show you guys so you see it and you have a general idea of what cataract surgery looks like, okay? I'm gonna play it.
Usually with cataract surgery, a small incision is made in the eye. The front portion
So here is the cataract, okay? It's cloudy, it's yellow, and this is what they're gonna remove.
of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
All right. So pretty straightforward. I mean, it's obviously not 45 seconds to do this surgery, but I wanted you guys to get some type of idea of what cataract surgery actually is, in case some of you were considering it.
Usually with cataracts.
Okay, moving back a little bit further now, I want to talk about the retina. So the retina is a little bit more difficult to show on this diagram, but it's actually a very thin, almost like wallpaper that lines the back of the eye. Okay, so I'm kind of tracing it with my mouse. It just lines the entire back part of the eye. Okay, you can see these vessels here, the blue and the red vessels, part of the retina. They supply the blood to the retina. Okay, the retina is very, very important because it detects the visual images, and then it takes all of that information that our eye gets from the light that comes into it, and it sends it back to the brain so that our brain can process what we're seeing. Okay, so that's what the retina is. It's all the way in the back of the eye. There's a specific part of the retina called the macula. And that is, all I want you to know is the macula is the center part of the vision. So when you look at something straight ahead and you see it crystal clear, that image that you're seeing, the thing that you're looking at, is landing onto your macula. And the macula is responsible for your center vision, the very clear, colorful center vision, okay? Now, over time, in some people, there's thinning and deterioration of the macula, okay? With age, it might happen a little bit, and then with some people, it might happen more rapidly. And that's something that we call macular degeneration. So I'm sure some of you have heard of macular degeneration. So the issue with macular degeneration is that there's fat and protein that will deposit, or it'll collect under the retina, and it'll break down some of the important cells that help detect the light right in the center of the vision, right in the macula, okay? So if the macula is responsible for your center vision, and macular degeneration means that the macula is slowly dying, then what you should expect to notice is that the center of your vision is not as clear anymore. And so I put an example here of a picture. This is what a normal person would see. Okay, the image is very clear of these three lovely people smiling and having a conversation. And then if you go over to the right, there's a picture of someone with macular degeneration. And you notice that it's mostly the girl that kind of lands in the center of the vision that's very blurry and out of focus. You also might notice that colors are more dim and not as bright, and you might have difficulty recognizing faces, again, because that's really the center of the vision that's responsible for that. So the people that have macular degeneration, sometimes we'll give them a grid that looks like this. It's called an Amsler grid. And they monitor if there's any worsening of their macular degeneration when they look at the center dot on this grid. So if I look at the center dot on this grid, all of the lines here look straight to me. But in someone with macular degeneration that is getting worse, they'll see something more similar to the picture on the right. So some of the lines are wavy and crooked, and they look distorted. Okay, so that's something that you might notice in macular degeneration. So how do we prevent it? Again, in people that have macular degeneration, or that people that are prone to get macular degeneration, it may not be 100% preventable, but things that we really strongly recommend, the first is smoking cessation. So smoking really, I think it doubles the risk of worsening macular degeneration. And then there's also been some reports of, limiting alcohol can help prevent the progression of macular degeneration. Eating healthy diets, so like leafy greens, fruits and vegetables. I mean, that's important for your overall health, but it also helps with macular degeneration. And then there are maybe some reports that talk about blood pressure control and whether or not that might help decrease how quickly it progresses. But really the most important thing is that you get your eyes checked, because every time we do your dilated exam and we put those drops in and we blind you with those bright lights, we're checking for these things. So, we keep a really close eye on you, and the best thing you can do for yourself is make sure that you're seeing an ophthalmologist every year or so to get your eyes checked. The treatment for macular degeneration is not that exciting right now. The most that we can really do is prevent it from getting worse or slow down how quickly it progresses. In people that have macular degeneration, we'll start them on a special type of vitamin that it's not just a multivitamin, but it's got some vitamins and minerals that have been shown to decrease how quickly the macular degeneration progresses. And then in some people that have what we call wet macular degeneration, it's a specific type of macular degeneration. They'll need injections into their eyes to prevent bleeding and worsening of the progression of the disease. Okay. Okay. I want to talk a little more about the retina, because it's actually, like I said, it's a very, very important structure in the eye. You all see, I'm sure, your primary care doctors, and they tell you need to eat healthy, stop smoking, all of that. But, really it's important for us as well. So when you come see us, we're going to tell you, eat healthy, don't smoke, because making sure that your whole body is healthy will also make sure that your eye is healthy. Okay, so let's say, for example, how does diabetes affect the retina? Okay, so the first picture I showed you was a perfect, beautiful retina. It's got kind of like an orange color, and this darker part in the center, that's the macula, and this yellow part here is a nerve in the back of the eye. And so this is a really, really nice, healthy retina. Now, if you look at the retina down below, that's affected by diabetes, so it doesn't really look as nice, right? So you see these little red dots here. This is blood that's leaking from the vessels in the back of the eye. You see these darker, or like kind of a bright yellow spots. These are deposits that also from the vessels, they get into the retina and they can damage the retina. And then you can get swelling in the macula, the center part of the vision from diabetes as well. So keeping your blood sugar under control, if you're able to, getting off of insulin with the help of your doctor, also really good for your overall health and for your eye health to prevent, you know, this type of disease affecting the retina. Blood pressure is also very important. So this is an eye down here that where the retina has been affected by high blood pressure. So again, it doesn't look as pretty and clean as the first retina that I showed you. Here you can see these red spots. This is all hemorrhages. It's blood that's leaking from the vessels as well. And then all of these bright yellow spots that you see, it kind of looks like a pizza. All these bright yellow spots, this is parts of the retina that's not getting blood supply. So this is part of the retina that can die because it's not getting enough blood, okay? So this is an eye that's affected by high blood pressure. Can also cause swelling in the macula or the center part of the eye and really decrease the vision that way. Okay. I think I'm kind of running a little bit fast, actually. I wanted to stop here before I talk about a little bit about low vision. I want to just kind of go back and see if there are any questions on, I know we talked about a lot of the structures, but any questions on the first three structures that we talked about?
So there's a couple questions in the chat box, so I'm gonna do them in order. So the first one is, what causes the grit in dry eye? Are cells sloughing off?
Good question. So let me go back to the cornea part here. So that's a really good question. It's not that our cells are coming off, but when our eye is dry enough, we do see like parts of the cornea that have, it's almost like little dots where there's like a defect there. And what happens with that is that the very front part of our eye that's very sensitive starts to have almost like little pinpoint scratches on it. It's not a real true scratch on the cornea, but they're very, very small little defects. And so that our eye is very, very sensitive to that. I mean, the front part of your eye, the cornea, is extremely sensitive. Think about, you have one little eyelash in there and you can't even open your eye. So even just those little defects that you get when your eye is dry enough will cause you to feel like there's something in your eye. It's gritty, it's sandy.
Right. Next question, cataract surgery, can it cause double vision?
Yeah, that's a really good question too. So double vision is interesting because some people have double vision just in one eye. Some people have double vision when they have both eyes open, but when they close one eye, it goes away. Usually cataracts themselves can cause double vision. Cataract surgery on its own does not typically cause double vision, but your cataract might cause that. And some like dry eye also sometimes can cause double vision if the surface of the eye is not regular. But in and of itself, cataract surgery shouldn't cause double vision.
Okay, let's see. Sunlight and light in general started to bother my eyes. What could be the cause for this?
So it could be many things. Light sensitivity can range from something as simple as dry eye can give you some light sensitivity, or it can be something more severe like inflammation. So there's quite a range there. If you notice that it's just a little bit sensitive to the light and maybe you have some irritation, you could try lubricating your eyes and treating for dry eye and seeing if that helps. But if your eyes are really, really light sensitive, then it's probably worth just getting them checked out and evaluated by an ophthalmologist so that we can make sure there's nothing else going on.
Okay, thank you. Next
Mhm.
question. I was told I benefit from cataract surgery for distance. Does it make sense to give up close vision where I don't need glasses? They go on to say getting prescriptions difficult. They find within 1 to 2 weeks they need a stronger strength, and they wear progressive lenses.
Okay. So when you are going to your doctor and planning out cataract surgery, you get the option of choosing between a couple of different lens implants that they put in your eye. So I don't know if you remember from the video that I showed, but they removed the cataract and then they put in an implant where the cataract was, so that that implant can focus the light on the back of the eye and do what the old lens should have been doing. Now, when that happens, that implant is flat. So it's similar to the old natural lens you had, but the difference is that it can't really change shape. So we ask you, do you want to be without glasses for distance vision, or do you prefer to be out of glasses for near vision? And it's a discussion with your doctor, because if you have been nearsighted, so if you've been not needing glasses to read for your entire life, and that's really important to you, and you say, I want to be able to read and knit and sew and cook, whatever it is, I want to be able to do all of that without glasses, then you should talk to your doctor about getting an implant that will correct you for near vision, so you don't need glasses when you're doing all of those things up close. However, if you do that, then you will definitely need glasses to see far away. Okay, because again, that lens implant that we put in doesn't change shape. If you tell me I love to golf and I don't want to drive with glasses because I hate to do that, those types of activities you really don't want to have to wear glasses for, then I'll say it makes more sense to correct you for distance vision. So we'll put an implant that gets you to see distance, hopefully without glasses. But in that case, again, you're gonna need glasses for reading and doing things up close, okay? There are some specialty lenses that, with the aim that they can get you to see distance, intermediate vision, and near vision. And those are specialty lenses that some ophthalmologists might also offer. But they all have their pluses and minuses. I think getting cataract surgery, if you need it, is worth it, even if your prescription is going to change after the surgery. Usually, once you get the cataract surgery, your prescription stays pretty stable, because that new lens we put in is not going to change. It's not going to develop a new cataract or anything like that. So you just have to figure out what's important to you. Do you want to see distance, or do you want to see up close? And then discuss with your doctor about it.
Great. All right. Thank you. That was a great answer. Let's
Yeah.
see. So I'm kind of sifting through. Sorry, folks. There's a lot of questions, so I'm just trying to pick the ones that are gonna hit the most people at once. Can you talk a little bit about, or do you know anything about the recently approved FDA drug for dry MACD?
Yeah, so I can talk a little bit about it. It's pretty new, and we are not, most of the retina specialists that I've spoken to are not giving the drug quite yet, because it's still pretty brand new. But essentially, it's an injection, and the studies have shown that it prevents the progression of a certain type of severe macular degeneration called geographic atrophy. So this is getting a little bit more complicated, but essentially it's an injection that hopefully can really slow down severe macular degeneration from progressing. And again, I haven't seen it injected yet. I think it's still pretty new and fresh, and hopefully it really helps a lot of people with the macular degeneration, and we get it into our clinics here. But it's still too early to tell how effective and what kind of side effects it's going to have.
All right. Thank you. Next question. Oh, okay. So if someone's experiencing glare, they ask, should I see a cataract specialist or a retina specialist or someone else?
Mhm. So if I think a good first stop is to see a general ophthalmologist, and then they'll do a full exam and they'll look at they will look at the retina too. And if they feel like you need to see a retina specialist, they'll definitely send you to a retina specialist. But glare symptoms are not typically findings related to the retina. It sounds more like maybe cataract, maybe something on the surface of the eye. But in general, if there are any eye complaints that you have, it's good to see just a general ophthalmologist. And then again, they'll send you to subspecialists if they feel that you need to go.
All right. Oh, here we go. Can you speak a little bit about macular puckers and macular holes? How are they treated?
Sure. So macular pucker is essentially when the macula, which again, the whole retina is like a thin wallpaper that lines the back of the eye. And it's usually flat. It's flat up against the back of the eye. Sometimes when, as our eye, it ages and changes, the jelly that is in the back compartment of our eye that's attached to the retina starts to change. It starts to become less jelly-like and more liquid-like. And then as it does that, it starts to remove itself from the retina. Okay, so the jelly part of the eye starts to slowly peel away from the retina. Sometimes when that happens, there are strands of the jelly that stay attached to the macula, for example, and it'll tug on the macula and lift it a little bit. Okay, and that's something call it macular pucker, and it can sometimes cause things like macular holes. Macular holes are sometimes treated with drops, depending on how severe it is. Sometimes you need surgery to treat macular holes and macular pucker.
All right. And here's a question that's going to transition us into low vision. I am in my 80s, and recently I found I need a magnifying glass to read a newspaper. Is that normal when it comes to aging?
That's a really good question. So let's talk a little bit about that. Your vision changes as you get older because of all of the things that we talked about today. And sometimes the need to use a magnifying glass when you're reading things up close, it just means you need reading glasses. And so you could go to your doctor and they'll give you a pair of reading glasses. And then those reading glasses magnify the font a little bit, so then you don't need to use the magnifier anymore. But there are some diseases that cause more permanent vision loss, and people that have low vision sometimes need to use things like magnifiers to be able to read and do things, up close. And so let's talk a little bit about that. So there are so many tools out there now that help with low vision. There are things like this handheld, it's like a handheld magnifier, handheld lights. You can speak to like an occupational therapist and they'll help you set up your home in a way where you can navigate it, install brighter lights and make sure there's nothing in your way so you're not bumping into things, falling. All of those things are really important because you want to set yourself up for success if you're dealing with low vision. And then there's also things like voice recognition. You could, hey Siri, your phone, and my phone just listen to me now. So there are so many things out there. The technology is really advanced. So there are a lot of tools for people with low vision. I actually did some research on apps that you can get on your phone or your iPad, and that I thought were really interesting and probably very useful, not just for people with low vision, but even people like commuting or the people that want to minimize their screen time. So I think a lot of people know Audible already, but it's an app that will read books out loud for you. And then similar to that one is something called Speech Central. And that one, you essentially kind of copy paste like a website or something that you want it to read, and you put it into the app, and it'll read that article out loud for you. So then it's not just books, but things online that you want to have read to you, it'll do that for you. Super Sense, which is this black one here, is an app that recognizes objects around you. So you can open it up on your phone. It's like a camera. And then as you're pointing it at different things, it'll read out like what it thinks that object is. So like it'll read TV or computer or remote. I read my dog as a cat, so I don't know how reliable it is, but my dog does kind of look like a cat in all honesty. And then you can get apps also on your phone for like magnifying glass and light. And if you don't want to buy like this handheld device, there are definitely apps for that as well. Here's my dog that looks like a cat. Happy to take more questions if there are any.
Well, I guess the first question is, how long have you had your dog and what's her name?
So I've had him for 3 years now. His name is Aika.
Aika, okay. Dr. Murdock, thank you so much. We do have a couple more questions in the chat box.
Sure, absolutely.
Keep them through this.
Yeah.
Just kind of wrapping up low vision. When is it time for folks? When should people consider themselves low vision, or when would they benefit from some of these apps that you shared?
So it depends on the person, right? And you can try the apps and see if they help you. And if you feel like your vision is not good enough to navigate, to read fine print, to do the things that you like to do, to like, if you feel like you need more light, it's really up to you. I mean, these apps are there for you to use if you want them. And I don't think there's necessarily a threshold that everyone meets. It just kind of depends on the person.
Thank you.
Dr. Murdock,
Yes.
a number of years ago, it started with my optometrist, but my ophthalmologist agrees on using Ocuvite, the lutein and antioxidants vitamins. What's your opinion on that? I mean, I've been taking them for years. Do you think they do anything?
That's a good question. I've heard some people say that they really helped. When it comes to vitamins and doing things that are healthy for you, I don't think that and antioxidants, I mean, I don't think there's really any harm to it. So it's mostly anecdotal, whether or not, it'll help someone. But I've heard some people have benefited from it.
All right. One question we've gotten a couple of is, what happened are retina issues and glaucoma related? Yeah.
That's a really good question. Glaucoma is a disease that I wish I had touched on, because it's also one that's very commonly heard, and actually people mistake it for cataracts a lot. Glaucoma is different. So glaucoma is a disease that you don't necessarily get just by getting older. So there are a lot of risk factors for getting it. One important one is if you have family members that have glaucoma, definitely go get checked out, just see an ophthalmologist. Even if you're on the younger side, it's good to get to establish care early, because having a family history really puts you at a higher risk for getting it. And it's not really a retinal disease. It's a disease where the optic nerve, the nerve in the back of our eye, that is responsible for sending all of the visual signals that the retina collects, sends it back to our brain. So it's like the optic nerve is like a cable. It connects the back of our eye to our brain. So that nerve in glaucoma over time thins and dies. And we don't know all of the reasons that it happens, but we do know that one of the main risk factors that accelerates the death of this nerve over time is elevated eye pressure. So you might hear people with glaucoma have high eye pressures and they're on eye drops or they needed surgery and those types of things. Number one, having high eye pressure does not mean by default that you have glaucoma. And number two, not everyone with glaucoma has high eye pressure. Some people have normal eye pressures. So they're not 100% related, but glaucoma is also, like, you know, very commonly heard disease that can be very sneaky and can take vision away in a way that you might not notice at first until it's very advanced. So the main takeaway is, if you know a family member that, like, you know, parent, uncle, cousin that has glaucoma, I would definitely recommend that you get an eye exam just to make sure that you're not showing signs of glaucoma as well.
All right, and just a follow-up question. Speaking, you mentioned about telling your family members about if you already have glaucoma. Are other conditions that you talked about today hereditary?
Yes. So macular degeneration, also you're at increased risk for developing it if your family member has it. And what else did we talk about? Cataracts, not really. Everyone gets cataracts. And dry eye, not really. You know, some forms of diabetes are hereditary. And for diabetes, it's mostly just keep up with your primary care doctor and see an ophthalmologist pretty much yearly to get checked for that. And same with the high blood pressure. You know, those are things that can affect the back of your eye also in a way that you might not notice at first until it's very advanced. So, but really the only hereditary ones or ones that you're at increased risk for if you have family with it are glaucoma and macular degeneration.
Great, thank you. Someone asked about putting the names of the apps you mentioned in the chat. Could you, if you just go back to that slide, I can throw it in there real quick.
Yes, sure.
Okay. And then let's see. Someone wants to know about prevention tips. What would be your top prevention tips for preventing any of these, like, eye conditions?
Yeah. Seeing an eye doctor regularly. That's the best thing you can do, because it's our job to know about all of these conditions and to do a very thorough exam to make sure that you're not developing them, or if you are developing a cataract, we educate you about it. It's not your responsibility to have all of this information memorized. That's our responsibility. So to take the stress off of you, seeing your eye doctor, you know, on a regular basis, come back when they tell you. If they say come back in 6 months, come back in 6 months, not in 5 years. If they say come back in 2 years, come back in 2 years, you know, keeping up with that, just like how you keep up with your primary care doctor. That's probably the best piece of advice I can give in terms of preventing these diseases.
Okay, and then we've had several questions that a lot of people are asking about cataract surgery. Basically, what are there any side effects, and then how long does it take to recover before you're back 100%?
Sure. So every surgery has risks, and don't believe anyone that says otherwise. You know, nothing is ever guaranteed 100% when it comes to surgery. Depending on you and your eye history, the risks might be different from person to person. So the best person to individualize those risks of surgery for you is your doctor, because they know your eye better than I know your eye. But you know, infection can happen with surgery on any part of the body, not just the eye. You can have inflammation that recurs, like you might have to be on steroids for a longer period of time. You might still need glasses. That's a big one. So we'll do our best to try to get you out of glasses, but it's never 100% guaranteed. And then there are some other things that can happen. But again, I would, before you get cataract surgery, just have a very detailed discussion with your doctor about your specific risk factors. And then the second one was the recovery time. Again, it depends on you, your body, how your eye heals, but there are people that come out of cataract surgery the next day and they have 20/20 vision, and that's great, and they're seeing clearly right off the bat. Some people need a little bit of a longer time to recover, and that's also okay. It doesn't mean that they won't get to 20/20 vision, or, you know, that there's something wrong with them, but it just really depends on the person. Some people might take a week, some people might take a few weeks to recover. So it just varies.
Okay. All right, so let's see. I think we're about done. It is about 4 o'clock.
Yeah.
Dr. Murdock, could you just put to your reference page real quick? Somebody was asking about that.
Sure.
There we go. Okay. All right, Dr. Murdock. Well, thank you so much for today.
You're
This was a
very
really,
welcome.
really informative presentation. You covered a lot of ground in a little bit of time. Very, very impressive, of course. So I thank you very
Sure.
much.
Definitely. Happy to answer more questions if you guys reach out to me with them, and I'm happy to help in any way I can. But really, most of the questions you guys are asking, your eye doctor can answer. So never feel like I'm the only resource. Like, you see your doctor, they'll be able to give you all this information again, or any new information.